Okay, Assalamualaikum warahmatullahi wabarakatuh. So for this topic is on anxiety disorders, and there will be questions in MCQ that will come out. So you need to pay attention for anxiety disorders. So anxiety disorders is a common experience, especially for us if we experience any threatening situations. For example, the simple example will be having exams. So we perceive it as a threat situations and we start to produce feelings, thoughts related to these threatening situations. So for example, exams, you students starts to become worry. So when we think about anxiety disorders, it is a form of neurotic disorders, but the condition is due to unnecessary as well as uncontrolled worry or excessive worry. So here I will explain further about anxiety disorders in more detail. So when anxiety is considered abnormal, it's because after certain durations, the anxiety develops further and until it becomes severe and it causes stressful circumstances for the individuals to go to work, to perform their tasks, until to that level. So it even occur even the absence of the stressful circumstances. That means there is no threatening situations present during the anxiety, and it is associated with any physical, social or occupational functioning. So here it means that it even make the person to withdraw, to uh, to absent from the work and not to focus on their task. So anxiety disorders include a group of disorder in which anxiety is the main symptom, such as palpitation, excessive worry, uh, and fear, and so on. So I believe you already learned in your first year about the psychological model of stress, which is fight or flight response. So from the biological perspective, or neurotransmitter, neuroendocrine, so we believe in this role of norepinephrine. But in the interpersonal model, actually during the childhood, there are certain behavior or response that we learn from the others, that we learn from the according to the situations before this during your childhood. So it is acquired learned values from the others as well as from the personal experience, and during the adult, how individual cope is based on their coping skills or the conflicts or the maladaptive coping that happens when they were child. Yep. And the symptoms of common anxiety disorders. We have different types of anxiety disorders, but the common symptoms are worried, fear of something bad will happen, which is unnecessary, and physically the person show trembling, menggeletar, or twitching or feeling shaky. So be careful for those who are quite restless during the class. If you frequently shake your legs, that means you are restless, or the person easily become fatigued and restless. There's a muscle tension, especially at the neck, or jittery movement. Feeling dizzy or lightheadedness or easily faint is another common anxiety. Just imagine that the person become panic, so they tend to become dizzy and faint. Fast heartbeat associated with increase in palpitation and increase in breathing rate. Lastly, sweating or cold and clammy hands. So there are other symptoms such as dry mouth. Sometimes you think that is due to stress, so person tends to have dry mouth, nausea. So for those who are in so much anxiety or panic, they tend to become nauseated, they tend to vomit or diarrhea, such as butterfly in the stomach. So increase in intestinal movement can cause diarrhea. So it is common for those who are having stress due to exams. So you before the exam starts, you need to go to the toilet, yeah, and become irritable, impatient, or easily distracted. This is the common feature for anxiety patients. Uh, they cannot wait, yeah. They want things to get very fast, and they are very distractible because they cannot focus. They have a shortness of breath, especially those who are in panic. They become breathless, difficulty of breathing, as if they are having asthma. Some have a difficulty of swallowing. Some has sharp pains in the chest or chest discomfort, abdominal pain or stomach pain, hot or cold flushes, or fear of losing control or dying or going crazy. This is common in those with PTSD. Yeah? And the first disorder that I would like to highlight here is the generalized anxiety disorder. So generalized anxiety disorder is a common anxiety disorder. It is not associated with any triggers. Okay, but those with generalized anxiety disorder, the feature is that there is unrealistic or chronic or excessive, or we can call it as unnecessary worry, which is persistent for at least 6 months. Okay, and it is called the person to have significant distress or impairment in the work, as a student, as a mother, as a father, and so on. And the symptom is that the people or the individual tend to become restless, feeling on the edge, as if they are not safe. They easily become fatigued because they have so much energy put on the being palpitation, uh, and become restless, and they have difficulty in concentrating because their mind is preoccupied with the unnecessary worry. That's why they cannot concentrate on the present moment, on the task, and so on. And they become irritable due to their excessive worry or anxiety as well. Yeah. And second disorder is the phobias. So there are certain individuals who have, for us, their phobia is not realistic, is not logic, and it's not according to the situations. And these phobias actually can develop when they are in a child, they during their childhood. And there are certain phobias, for example, for the specific phobias, this one you need to remember what are the specific phobias. So specific phobias refers to the certain phobia to the specific things or object. For example, fear of snakes, fear of driving, fear of flying on the aeroplane, and actually there are a lot of phobias in the world. We have hydrophobia, or it is known as phobia for the water. We have arachnophobia, which is phobia for the spider, and we also have zoophobia, phobia for the animals. But for the general, just need to remember about the specific phobia, if they phobia about certain things. And we have agoraphobia. Is a phobia where the individuals have this difficulty or worry that they might have problems to escape. Yeah, so they are fear of the confined space. So for the agoraphobia, they afraid to travel alone because they think they are not safe when they are outside. Okay, so they require some companion or friends or family members to accompany them whenever they go outside. Yeah? And for the social phobia, this is a phobia where the individual thinks that a situation would be in the public would be embarrassing for them. Okay, so this exposure to the social environment, to the public, make them feel embarrassed or they think that they are being humiliated. For example, like eating or speaking in front of the public. So during the event where they are exposed to the public or they are being afraid of public speaking or presenting to their friends, so the intensity increase when the time they expose to the public or to the social or to the event which cause them to present to the others, yeah. So they cannot do it. Example of social phobia would be during an award event, for example. uh, Maybe the person's is afraid to come up to the stage, yeah, to face everyone in front of them because they are afraid of being embarrassed or humiliated. And this panic disorder, it can happen when the person exposed to the phobia. So phobia is about being afraid of the certain things or objects or certain event, and panic disorder is a panic attack where it is a brief period about 1 to 15 minutes and the anxiety become peak. So in the peak of anxiety, actually the persons feel there's a sense of terror or until the persons feel that they are dying because they feel suffocated. That is panic disorder, and panic disorder is more common in women or those who are separated, and is common in the adult age. So panic is a intense fear or discomfort. Like I said, it is a fear of being suffocated with at least 4 of the following symptoms, and it is happens at the peak of 10 minutes. So just imagine within 1 to 10 minutes, the persons can experience palpitations, tachycardia, sweating, trembling, feeling of choking, feeling of shortness of breath, chest or discomfort, chest pain or discomfort, abdominal distress, derealization, and also feeling dizzy and lightheaded. So this panic attack is quite intense for individual, as if they are not they don't think that they are there. They think that they quite detached from the presence, yeah, during the peak period. And there are also fear of losing control or going crazy, fear of dying. Some of them feels a paresthesias or tingling sensation, and some experience the chill or puffless. So bear in mind that not all those who are in panic experience these 13 symptoms. At least 4 of the symptoms are enough for the persons to get the diagnosis of panic disorder. And this panic disorder can happen everywhere, yeah. So it does not give you any signals. It can happen during the driving, it can happen while you are being in the public, or it can happen while you are being trapped in the lift, for example, yeah. Or it can happen while you are having the exams. And so I have covered about generalized anxiety disorder, uh, panic, phobias and panic. So now we come to obsessive compulsive disorder. So it is a repeated or unwanted thoughts. That means the person is preoccupied about certain thoughts, especially on the hygiene or being contaminated. And there is a compulsive or behavior or the ritual behavior. It is not a habit, but it become an extreme repeated behaviors of, for example, like washing their hands. So it become extreme, and it serves to prevent the individual's extreme anxiety. So when the anxiety accumulated, the person turn into this compulsive behavior or their rituals to in order to cope with the anxiety. So the characteristic of obsessions involve a persistent or senseless ideas about such as fear of contamination or fear of illness. So the common obsessions include fear of being contaminated with germs, fear of forget, fear of losing, fear of misplaced something, so fear of losing controls, aggressive towards oneself or unwanted, forbidden or taboo thoughts about sex or religions. So for Muslim, it involves the obsessions with prayer, maybe performing wudus over and over again, and desire to have things in symmetrical or in perfect order or in the arrangement. Yeah, so this is a common obsession. So every individuals vary in terms of their obsession. Yeah, and for the compulsion, there's a repetitive behavior involved a cleaning, for example, a checking or counting. And due to these obsessions and compulsion, the person is not able to ignore the thoughts or the obsessions. So by compensating these obsessions, the persons or individuals keep on the repetitive behavior as if they cannot escape with the thoughts. So the common compulsion include excessive cleaning or hand washing, which is repeated, and it can even cause injury to the hands due to excessive use of the soap. So uh, you can check that there's some abrasions in the hands due to excessive rubbing, for example, and ordering or arranging items in particular in a precise way, and they take so much time to arrange things due to this occupation or obsessions, and repeatedly check things due to they obsess with the loss, or they afraid that there's a robbery, so they repeatedly check things like check many times the door is locked, for example. If they already drive their car away from the house, they will come back to the house just to check back whether the door is locked again and again. Yeah, so there is a repeated, not just twice, but it is again and again, which take maybe an hour or several hours. There's also compulsion involve compulsive counting, especially counting money, for example, or praying or repeated words silently. Yeah? So this is a example of compulsions. That is OCD, and I think this is the last one about the, or this is the second last one, which is the post-traumatic stress disorder. So PTSD, we call it in short. It is due to the psychological trauma. So there is a known trauma, or the person is already exposed to the trauma. For example, there's a physical assault or sexual assault, accident, drug addiction, illness, medical complication, or exposed to disaster, for example, war or disaster. I forgot about the war. So these traumatic events, like in drug addictions, the trauma involved maybe a physical aggressive or violence against the others involving their drug addiction issues. Okay. So here, with the exposure of the trauma, the person or the individuals will experience a persistent, which the persons keep on having flashback or nightmares. So that is why we call as persistent. They keep on having the thoughts or having the events in a form of flashback. And there's a persistent avoidance of stimuli associated with the trauma. For example, if the trauma involves gunshot, so if there is uh, any shocking sounds, yeah, or banging sounds, so they will associate it with that trauma that already happened in the past. So they will try to avoid the stimuli. And there's inability to talk about the things even related to the experience, because this traumatic event made them to feel numb, emotionally numb. They may not recall everything in detail if you ask them, yeah, because they are in a shock. You just imagine the persons are in so much shock, so they cannot provide you the details about their experience, about how they feel, what happens in detail due to the PTSD. And you need to also remember that PTSD is a form of anxiety. So anxiety involves difficulty in concentrating. And there's avoidance of things and discussion that trigger the flashback. So they will try to avoid about this memory. If the person interview or if the doctor interview the clients to ask the detail, they may try to avoid saying about the things because they're afraid of the situations. And re-experience symptoms, fear of losing control. This is similar to panic because the mounting feeling of fear or anxiety is something that is they cannot cope with. Yeah. And there is a persistent symptoms of increased arousal. That means they have a over arousal or over alert. We can call it as over alert, such as they difficult of falling or staying asleep. They become anger and hypervigilance. That means they put too much alert on certain things, yeah, because they're afraid that they may encounter back the situations, especially the flashback, the nightmares. And for the duration of PTSD, it must occur for over than 1 month. And there's a significant impairment in terms of social, occupational, or other important areas of functioning. So they may try to avoid people, they may absent from the schools or from the work because they need to cope with so many things that happens due to the trauma. And in comparison to PTSD, so between one day until less than 1 month, we can call it as acute stress disorder. So it is not called or identified as PTSD yet, but having acute stress disorder doesn't mean that you can ignore the patients, because the patients can also experience a symptom similar to PTSD, but the difference is just the duration. And for the pharmacological management of anxiety disorder, so normally the psychiatrist will prescribe benzodiazepines, for example, alprazolam, bromazepam, lorazepam, to make them feel relaxed. Okay. And this benzo can cause addiction because the patient tends to depend on the drugs whenever they think necessary. So it is best for the psychiatrist to monitor them by only prescribing this benzo like for a week. Yep, for a week, and the psychiatrist will cut down the dosage and make sure that it is down to minimal dose only. And also, those anxiety patients will be prescribed with antidepressant such as tricyclics, SSRI or MAOI. And for the psychological management, it is best to refer them for counseling and teach them relaxation technique, behavioral therapy for the phobia, especially systematic desensitization, where the patient will be exposed to their phobia little by little in order for them to cope with the phobia, especially for the phobia which is unavoidable, such as phobia of driving, phobia of social phobia. And cognitive therapy is to correct their or to adjust their mind about their anxiety or fear. Psychotherapy or individual and group where they can discuss with the others about how to cope with the anxiety. And for trauma or crisis, we can also involve client for counseling on crisis, debriefing, and provide assertive technique for them to cope with the anxiety. So this is very important for you guys to remember. So if you happen to in the ward, it is not common for you to meet patients with anxiety, because those with anxiety, PTSD, acute stress or phobia, they will be treated via outpatient only. Yeah? So if you happen to meet patients or your friends who are anxious, so it is best for you to stay with the person or stay with the client, because if the person is left alone, it will increase anxiety. But sometimes the persons or the individuals, they don't want their friends or the stranger is too near to them, yeah, because the anxiety may be accumulated by having someone who they are not familiar with or having a stranger next to them. So it is best to have some trust and stay with your client, although the client, they don't want you to become near, but maybe you can stay with them from by having some distance. And you need to approach them with a calm manner. When you talk to them, when you ask them to breathe, for example, you need to use short and simple sentence, because those clients or those people who are anxious, they have difficulty to concentrate and to even listen to instruction. And we need to move the client to less stimulating environment. For example, if they are in the crowded, or if they are in the situations of threatening, for example, like exams, so you need to bring them out of the situation or out of the place for them to feel calmer, or to keep on exposing to the same stimulus. So you need to distract them to the other place. And this is for the maintenance. We need to teach the clients or individuals for the physical activities to reduce the anxiety. Yeah? For example, it is best to have a client soak in a warm bath, because it can cause some relaxation. So the client or individuals can listen to any soothing music, even the instrumental music without any lyrics, or zikir, or Quranic recitations is the best to listen to. It is also best for the individuals to take a walk, or having brisk walk, or some light exercise, not too rigorous exercise, as they may have shortness of breath, or they may feel fatigue or lethargy. Yeah? Having a massage, especially at the neck. Uh, those anxiety patients need to avoid alcohol, caffeine, and also nicotine. So this caffeine can trigger more palpitations, yeah. And also it is best to do some relaxation techniques such as breathing, some yoga, and also meditation, zikir, and so on. And we also need to teach the client about the medication. So like I said, benzodiazepines can cause sleepiness, addiction. The patient can become dependent, and the patient can become addicted to the benzodiazepines. So we need to teach them that they need to aware of the drugs and their side effects, such as sleepiness, and also the importance of taking medications as to control their anxiety, especially those who are panic. And at home, for example, we can encourage the clients and the family members to discuss about their feelings, about their worry, about their anxiety, and be non-judgmental. Use simple, clear, and concise explanations, and do not overload the severely anxious client with more information that she or he can handle, because they are so distractible, they are so preoccupied with their thoughts. So if you already met with those who are anxious, they even cannot make eye contact with you. They are in intense mode, they always look down, and they always look shaky and trembling, yeah. So that is those with severe anxiety. So we also need to promote safety. We need to advise client not to perform any potential activities such as driving if let's say patient can experience a panic attack while driving, for example, or while they are alone. And promote optimal tissue perfusion and elimination. We need to encourage patients to take a proper nutrition intake, take a proper meals, have adequate activity, yeah? Because those who are anxious may also not take their food properly. They may think that they have gastritis, so they prefer to have empty stomach rather than to take proper meal. And that's all. So I hope this lecture notes is enough for you to prepare you guys for the exams. Thank you and Assalamualaikum.